Right, now we have the managing partner of Pharmacy 777 Maylands, worked as a pharmacist for 6 years, incredibly passionate about impacting the health of our community, especially in the area of wellness and nutrition. Jaye Burns, hello.
Hello.
Tell us a little bit about your journey in the world of pharmacy.
So I started 6 years ago. I started out in a few independent pharmacies and then moved into the discount model after my internship, and then I sort of just decided that wasn't really for me. I kind of missed the patient engagement that I got from the independent pharmacies that I was involved with. So then that led me to study my HMR course and just have that direct patient engagement again. And obviously I ended up pursuing a career at Pharmacy 777 for that exact reason as well, just to move back more into that direct patient engagement service model.
Yeah, and what's the most rewarding thing you find from your job?
I love having a direct impact on patients' health, and being that it's a forward-facing model, it just allows you to actually feel that impact directly rather than being behind the scenes, being behind a computer and just dispensing and things like that. That's not really for me. I'm very much a people person, so that is something I adore about community pharmacy, specifically in the Pharmacy 777 group.
You see it and you feel it?
Yes.
Yeah. What about challenges? What are some of the things you find challenging?
I guess managing a team, I would say. Always people management, in my opinion, is the biggest challenge we can have. I guess everything's always about the patient. That's why we do what we do. And I mean, that's what keeps feeding our passion and, you know, what continues the business running, to be honest. But obviously you need a team to be able to do that. So that's something that I have really enjoyed about being an owner as well, is basically being able to be in that position where you've got the opportunity to build a team and hopefully find people with shared values that are all looking to provide that same patient outcome that you are, and feeling the passion as much as you yourself as the owner. So that you know that, you know, when you're not at work, we've got this consistent health service that we're delivering to the public all the time. In saying that, obviously, like I said, the challenge is the people, because you've got to find the right people and you've got to be able to inspire them and motivate them to be able to continue delivering that for the patients.
You have to set and build your own culture.
I mean, at my store specifically, we have a really big focus on team culture. It's something that we're really big on, because I think being able to deliver that exceptional care for our patients and having that really positive impact on the community really does start with our team. If our team are all happy to be at work and, you know, they're feeling the passion and they're excited and motivated and everything, there's so much more chance that we can have that, you know, outcome that we want.
Big changes in the pharmacy industry right now. What are you seeing?
So obviously the big elephant in the room is the expanded scope of practice. And that's really, really exciting for our industry as a whole, specifically community pharmacy, and really exciting for service-based models such as our group Pharmacy 777, because obviously we're all about delivering full health solutions. So this just allows us a lot more opportunity to be able to do that. I think that pharmacists have been freely giving advice for a very long time. It's always been, I guess, a health hub in a community where people can just walk in off the street and get their health advice, which is great, but there's always been a barrier. So, I mean, for a long time, we've, you know, been there to give health information, we've been there to assess, we've been there to diagnose, but we've not always been able to provide a treatment option. So we've always had that kind of barrier and restriction, and then it's meant that some patients have had to wait, you know, a few days to see their doctor, and in some cases, especially bulk bill cases, people are having to wait weeks. So this can just mean that, you know, there's poor health outcomes, or, you know, someone's lost trust in the health system, or maybe clogged up ED, so many things. And as much as there are like online doctor services and things like that now, I really do believe that there is so much more value in face-to-face consultations. I mean, we're all people at the end of the day, and I think that's where you can have that really positive connection. So it just means we can just go that one step further. So in the future, it will just basically result in more efficient healthcare system, hopefully. Obviously, there are challenges that come with that, but it's a really exciting space to start navigating, really.
So with scope of practice, do you see any new opportunities coming with that?
Yeah, definitely. So like I said, it's really, really exciting for us to be a part of, because we are so passionate about providing that full health solution for the patient. So it just means we can go that step further for all of our patients. So where before they would be, coming in, getting their health advice, getting their information, maybe even getting a diagnosis and a treatment option, but maybe they weren't actually able to access that treatment option. So that will be the main, outcome of that. Yeah. And we might see, obviously, pressures easing in ED, easier access to GP appointments for more serious or more chronic disease management. So that's also really exciting for people with chronic health conditions, because they'll be able to access their GP easier, hopefully. I think those are kind of the obvious changes. And in terms of, I guess, less obvious changes, it will be things like the structure of the uni courses may change, and how does that look like? And when we're getting our new interns each time, how does it look like? How do we mentor them to be able to feel confident to actually deliver these services, and things like that? And I guess that's where we've got a bit of a challenge at the moment of not being able to actually access the courses to be able to deliver this expanding scope. It's just so limited. And what that kind of means is we've got a bit of a challenge of some of the newer interns are potentially going to be, finishing uni and having this qualification with no one in the field to mentor them. So that will be interesting to navigate also.
Speaking of students and interns, if you could give them one piece of advice, what would that be?
One piece of advice that I would say is, my main thing would be, say yes to everything within your capacity. Pursue every opportunity that you possibly can. There's not a lot that can go wrong with that. All the best things are going to come because you've said yes. The easiest way to be unsuccessful is to do nothing.
You miss 100% of the shots you don't take.
There you go, exactly. I think keeping in mind that prioritizing your own personal growth is most important, because obviously you do need the skills to back up whatever you want to pursue, but pursue your passion. That's where all the good, outcomes lie. I'm only sitting here as an owner today because, I sent an email randomly to HR at 777. There was not even any jobs advertised.
That's how it started?
Yeah.
Yep, you took a swing.
Yeah. If you don't ask, you don't get, right? Yeah. So I think, just throw yourself in, ask questions. If you've got a passion, you've got a curiosity, say it.
Yeah. I would have liked that advice 20 years ago in my life, but thank you very much. Jaye Burns, a pleasure.
Thank you.